This lecture is going to be on eosinophils and basophils. Eosinophil and basophil kinetics are similar to those of neutrophils in that there are bone marrow proliferation and maturation pools, circulating and marginal blood pools, and a terminal tissue pool. The main causes of eosinophilia are worms, wheezes, and weird diseases. Worms doesn't necessarily mean helminth infections, but it does represent the broader infection by any parasite, and then rarely fungal infections can cause eosinophilia. Wheezes represent allergic or hypersensitivity reactions, and weird diseases include both neoplasms and hypoadrenocorticism. With most diseases that cause eosinophilia, there is tissue inflammation and production of inflammatory cytokines, which goes back to the bone marrow and stimulates eosinophilic hyperplasia within the bone marrow, resulting in increased release of eosinophils into blood. Hypoadrenocorticism is an uncommon endocrine disease that typically causes decreased production of cortisol and aldosterone by the adrenal glands. In some animals with hypoadrenocorticism, they develop eosinophilia due to a cortisol deficiency. This cortisol deficiency is thought to lead to increased release of eosinophils from the bone marrow. Hypoadrenocorticism can cause several hematologic and biochemical changes. However, the most consistent change is a lack of a stress lymphopenia in a clinically ill patient. So, animals with hypoadrenocorticism may have anemia of chronic disease, they may have anemia due to GI hemorrhage, they may have normal concentrations of lymphocytes, or they might have a lymphocytosis. You'll learn more about the other ClinPath changes in future lectures, but in general, hypoadrenocorticism also causes abnormal energy metabolism and electrolyte and water dysregulation. The most common cause of eosinopenia is excess glucocorticoids, and this may occur with either stress, hyperadrenocorticism, or it might be part of an acute inflammatory leukogram. The eosinopenia is a result of a glucocorticoid-induced sequestration of eosinophils within the bone marrow, so there's decreased release from the bone marrow into blood. Causes of basophilia are similar to those of eosinophilia, except that it tends to not occur with mast cell neoplasms or hypoadrenocorticism. Basopenia is not a recognized pathologic change, and that's because the lower reference limit for basophils in most domestic species is 0, so you don't have to worry about basopenia.